Hi there, this is your nurse coach Cherie, and if you're struggling studying anatomy and physiology, these videos are for you. Please like and subscribe or comment so I can continue producing more videos for you. This is the second episode of many more videos to come, so let's start. Where do you find the Langerhans cells? Is it in the stratum basale? Is it in the stratum corneum? Is it in the stratum spinosum? Or is it in the stratum granulosum? So here is the Langerhans cells, and the answer for that is the stratum spinosum. So Langerhans cells are found in each layer of the epidermis, but more abundant in the stratum spinosum, which is the thickest layer of the epidermis. Stratum spinosum helps make the skin more flexible and strong. The Langerhans cells helps with the immune adaptive responses such as inflammation. Next question. Glucagon is produced in the pancreas by which cells? Is it the beta cells? Is it the alpha cells? Is it the delta cells or the gamma cells? So the answer is the alpha cells. So glucagon is a peptide hormone secreted from the alpha cells of the pancreatic islets of Langerhans. The alpha cells secrete glucagon as a response to low blood sugar. The main function of the glucagon is to release glucose from the glycogen stores in the liver. Okay, next question. Which of the following list the valves in the order through which the blood flows from the vena cava through the heart? Is it the mitral, pulmonary, bicuspid, and then aortic? Is it from bicuspid, aortic, tricuspid, and pulmonary? Is it from tricuspid, pulmonary, bicuspid, and aortic? And the last one is from aortic, pulmonary, tricuspid, and bicuspid. So the answer is in this photo, and you can see it. It is from bicuspid, aortic, tricuspid, and then pulmonary. So between the chambers of the heart, there are valves which are made of thin but strong flaps of tissues. They are tricuspid valve, pulmonary valve, bicuspid valve, and aortic valve. The blood flows from the body into the right atrium and then flows through the tricuspid valve to the right ventricle. The right ventricle pumps the blood through the pulmonary valve and into the lungs, where it picks up the oxygen. So the oxygen-rich blood then flows to the left atrium. Then the heart pumps the blood through the bicuspid, which is the mitral valve, into the left ventricle. Then the blood flows through the aortic valve to the rest of the body. Next question. The pharynx is divided into how many subdivisions? Is there 3? Is there 4? Is there 5? Or is there 6? So how many? There's 3. So the pharynx is divided into 3 parts. These are nasopharynx, which is located behind the posterior nasal apertures. The oropharynx is located behind the opening of the oral cavity. And the laryngopharynx is located behind the inlet or opening of the larynx. The nasopharynx lets the air pass through. The oropharynx connects to the mouth to let the air, food, or liquid pass through, and laryngopharynx helps in speech and voice formation. The next question. Which is the master gland of the endocrine system? Is it the pancreas? Is it the thyroid? Is it the pituitary? Is it the adrenal? Or it's the pineal? So the answer is pituitary. Pituitary gland is the master gland. It is the pea-sized gland located at the base of the brain below the hypothalamus. It is part of the endocrine system, and its primary function is to release hormones such as somatotropin, prolactin, TSH, ACTH, MSH, oxytocin into the bloodstream, which should reach their target organs and stimulate physiological activities. Next question. In the body, liver is described as the heaviest and second largest organ, the heaviest and largest organ. It's the largest and second heaviest organ, or the second largest and second heaviest organ. Okay, the answer is the heaviest and second largest organ. So the liver is located in the upper right hand portion of the abdomen, beneath the diaphragm and on the top of the stomach, right kidney and intestine. It is a dark reddish brown color that weighs about 3 pounds. The function of the liver are filtration, digestion, metabolism, and detoxification, protein synthesis, and storage of vitamins and minerals. It is the heaviest and second largest organ of the body. Okay, next question. How many pairs of cranial nerves originate in the brain? A is 7. Is it 9? Is it 12? Is it 13? So the answer is 12. So these are, cranial nerve 1 is the olfactory nerve, and it is responsible for the sense of smell. Cranial nerve 2 is the optic nerve, which is responsible for the ability to see. Cranial nerve 3 is the oculomotor nerve, and it's responsible for the movement and blinking of eyes. The nerve number 4 is the trochlear nerve, and it's for the movement of eyes for up and down and back and forth. The nerve number 5 is the trigeminal nerve, which is for sensation on the face, cheeks, thighs, and jaw movements. The nerve number 6 is abducens nerve, and for the movement of the eyes. Number 7, cranial nerve 7 is the facial nerve, which is the facial expressions and sense of taste. Cranial nerve 8 is for auditory or vestibular nerve, and it's responsible for sense of hearing and balance. Cranial nerve 9 is glossopharyngeal nerve, is for taste and swallow. The cranial nerve 10 is the vagus nerve, and it's for digestion and heart rate. And then the nerve number 11 is the accessory nerve or spinal accessory nerve, and it's for shoulder and neck muscle movement. And the last one is the hypoglossal nerve, which is the nerve number 12, and this is for the ability to move our tongue. Next question. What does the urinary bladder do? Is it to secrete urine? Is it to concentrate the urine? Does it dilute the urine, or it stores the urine? So there you go. The answer is to store the urine. So the bladder is part of the urinary tract system. The urinary bladder sits in the center of the pelvis. Its main function is to store urine. It works with the kidneys to get rid of the body waste products from the blood. Next question. The ileum is the longest section of what? The rectum, the liver, the small intestine, or the large intestine? So there you go. The answer is the small intestine. So ileum is the third portion of the small intestine. The small intestine is about 5.5 long and is the longest organ of the GI tract. It has 3 major divisions. The duodenum, the shortest region. A middle portion is the jejunum, which is 1 to 2 meters long, and the third one is the ileum, which is the longest portion of and it's approximately 2 to 4 meters long. Its function is to help further digest the foods coming from the stomach and other parts of the small intestine. It absorbs the nutrients such as vitamin, carbohydrates, minerals, fats, and proteins, and also water from foods. So that's the end of this video, and please like and subscribe and make a comment or request for similar videos to help you pass your exam in anatomy and physiology.